Welcome to the Healthcare Plus podcast, hosted by Quint Studer and Dan Collard. I'm Nicole Webb-Bodie, partner at Healthcare Plus Solutions Group. Thank you for joining us as we bring together leaders and changemakers from across the healthcare industry. In each high-impact segment, you'll hear about the latest challenges organizations are facing and learn how guests are rewiring solutions to drive real change. Plus, you'll walk away from each episode with practical tools, techniques, and best practices to implement in your own role and in your organization. For more information on your host or to listen to recent episodes of the podcast, please visit www.healthcareplussg.com/podcast. Now, I'm pleased to welcome today's host, Dan Collard, who will introduce you to our next guest.
Well, thanks, Nicole, and welcome to a very special edition of our Healthcare Plus podcast, the 100th episode. You know, when Quint started this as the Busy Leaders podcast exactly 4 years ago, neither of us knew we'd be here today together leading Healthcare Plus Solutions Group and doing our best to once again make an impact in healthcare. We featured industry leaders across the years, policy influencers, leaders from outside healthcare like hospitality and sports. And the common theme has always been, what can we bring a leader today that she or he can bring into their organization and have a positive impact? So thank you. Thank you to our guests. And most importantly, thank you to you, our listener, the reason we get behind a mic and host these conversations. And now, episode 100. Well, hi, everybody. This is Dan Collard, and welcome to another episode of the Healthcare Plus podcast. You know, earlier this year, we published an article in Becker's magazine talking about investing in those frontline leaders and folks on the front line of healthcare. In the article, I mentioned two nurse leaders from Hillcrest Medical Center in Tulsa, Oklahoma, the Chief Nursing Officer, Carla Yost, and their Director of Workforce Development, Dannette Staples. And they just happen to be my guests today. Ladies, welcome to the podcast. I'd love to have you introduce yourself to our audience. And Carla, why don't you go first?
Hi, I'm Carla Yost. I'm the Chief Nursing Officer for Hillcrest Medical Center. I've been here about 2 years at Hillcrest. We are a 656-bed tertiary care facility in Tulsa, Oklahoma. As a leader, I've had over 15 years of senior leadership experience, and I'm passionate about developing leaders and giving them a voice.
Tell me about some of the stuff you've done in your past, Carla.
I've had previous roles as Chief Quality Officer and Chief Operating Officer, but I'm settling very well into nursing and just continuing to give frontline attention and voice in developing frontline nurses.
Tell me a little bit about your education and maybe some things you're involved with.
So I'm passionate about developing others and giving voice, and I graduated with my master's from the University of Minnesota, and I'm very involved with American College of Healthcare Executives.
You know, Carla, I love that you're involved in ACHE because so many nursing leaders will be involved with the American Organization of Nurse Leaders or the ANA or other nursing-specific trade associations. But I'm intrigued. Tell me just a little bit about why ACHE and what it's meant in terms of value for you.
As we look at ACHE, it really looks at the operational side as well as the clinical. And as I share with my leaders consistently, you know the clinical, and you can also develop and learn the operational side. And bringing both of those two together really helps you become a very strong leader. And so you do have voice. Continue to do that and develop that financial and operational experience, and it will serve you well.
For any of our listeners that happened to go to the ACHE Congress last March in Chicago, you'll also know not only is Carla active in ACHE, but she's a presenter at ACHE. I love the fact that you were right there up on the stage with physician leaders from Hillcrest talking about your hospitalist program.
Yes, we had the opportunity to talk about our hospitalist program and how our physicians and our interdisciplinary teams work together to enhance our throughput. And so that was really a fun presentation.
It was fun seeing you there. But today's all about nursing.
Yeah.
Even though you were talking about hospitalists, today's all about nursing. And our other colleague in the room is Dannette Staples. Dannette, welcome to the podcast.
Hi, Dan. Thank you so much.
Let's talk about your current role, and then let's talk a little bit about where you came from as a nurse and a nurse leader. What's your current role?
My current role is the Director of Nursing for Workforce Development at Hillcrest Medical Center in Tulsa, Oklahoma.
So you're a nurse. About how long have you been practicing?
I've been practicing over 24 years.
Where'd you start your nursing career?
Started out my career in Nashville, Tennessee with HCA.
About how long did you spend there?
I spent over 12 years there.
So about half your career, right where you started. Let's talk about some other places that you practice across the country.
I've worked in the Pacific Northwest and began practicing in Oklahoma in 2011.
And so back here in the Tulsa market, essentially for the last 13 years.
Correct.
Well, that's what I like about both of you is you're really also the been there, done that nursing leaders. You're deep into operations. You don't come from a strictly academic background. And what I also like about you is you care for those that are providing the care for our patients in such a way. Carla, you said, I like to give them a voice. And Dannette, you clearly have that passion for development. So let's start there. Carla, I still remember the day that you came up to me after we had deployed precision leader development at the manager and director level. And you told me about this group that you have called the Nursing Practice Council. And you said something that stuck with me ever since then. Isn't it funny? We often wait to develop nurses after they're leaders, but not before. Tell me, first of all, about the Nursing Practice Council and tell me about the work that you're doing there.
Well, the Nursing Practice Council meets on a monthly basis, and there are frontline nurses from every department. And I just saw that leaders without a formal title were really seeking further development. And that day when we came together, Dan, and you started talking about precision leader development, I began thinking about those leaders that don't have a formal title. And I said, Dan, I think we have an opportunity here to develop those frontline nurses. And you said, tell me more. And that's when it started. And I took the information back to the Nursing Practice Council and presented the frontline nurses. I said, would you like for us to invest in leader development? And they were like, you mean we can be in the same room with the leaders, our leaders? And I said, absolutely. You would have thought it was like Christmas. And they were so excited. And so last year, it's been a year now, almost last August, we brought these informal leaders to the leader development and talked to them about how to have difficult conversations and how to lead on their units. And from that point, I've seen them grow, and I've seen them develop into really fine leaders that they feel confident, and that really helps in developing trust in the organization.
I tell you, I have often told people 2 of my very best days of 2023 were with your nursing leaders. It's like it was yesterday. And I remember specifically as you and with the help of your Chief Human Resource Officer, Carrie, you started really focusing on a real narrowed down list of skills, just like you were talking about. And I love this group because they're so real. And I remember one of the skills that was surfaced up was a skill set that they called reducing drama in the department. So you've been doing this for a year now. I know you had a big year-end celebration. Anything that just stands out from what you've seen from the Nurse Practice Council?
I think it begins with development of trust. And trust is about relationship. And through the monthly meetings with the frontline nurses from every department, I was able to put in a listening mechanism where we were able to distinguish what was drama in the organization and what was the what were the true goals and direction of the organization. And understanding that gap and narrowing that gap has been very helpful in us advancing around our patients' experience and employee engagement.
You sent me a picture at the end of the year, or maybe it was right after the first of the year, of sort of your year-end celebration. And I remember the looks on their faces. And maybe even a couple that were surprising that they were so engaged. From a nurse relationship standpoint, what's that like as a chief nursing officer?
It's engaging and it's emotional. And I think you mentioned that we did a celebration at the end of the year. We held a celebration and honored about 58 nurses around the core values of compassion, accountability, and teamwork. And we brought those nurses, those same nurses that we said, we're going to develop and invest in you. We brought them together in the room and we gave them awards for those core values. And they were able to not only see, but they were able to hear what really makes an outstanding nurse. And that builds a lot of trust in the organization.
Couldn't agree more. And just judging from the smiles on their faces in those pictures that you sent me, it's clearly already having an impact. Now, you began with the Nurse Practice Council, but you also identified, based upon your own experience, based upon Dannette's unit experience that we're going to go into in detail here in just a little bit, but also things like our recent Models of Care study, where the role of charge nurse has emerged as such a critical role. And so you brought Dannette into this new role of Director of Workforce Development. And so before I bring Dannette in, I'd love to have maybe you tell our listeners something about Dannette. If I was to ask you just a couple things about Dannette, what would you tell me?
Well, Dannette is very enthusiastic and engaging, and she's the type of person that gets up every day and really looks for how that she can engage with others and celebrates that. She's not focused on herself, but she exudes that personality that I care about you as a person. And that's really, really, really strong. When she came to me with the idea of workforce development, at first I was a little leery because we are focused on operations. And then I began thinking, I have to have someone every day get up and think about what are we going to do to develop and invest in nurses. And that's where Dannette came in. She operates at 110% and is always there for the person that's in front of her.
This is the one time that I always wish our podcast was on video, because if our listeners could see the smiles on both of your faces, which speak to the sort of the mutual admiration that the two of you have for each other, I think it'd be a treat, especially for nurse leaders across the country. So, Dannette, we meet. I'll never forget the first time you said, I have some success metrics from our orthopedic unit. Why don't we start there? Let's start when you were in your role as the leader of the orthopedics unit. You were so excited about these metrics. Why don't we share where this all began?
I will, Dan. Thank you. Let me ask you this. Have you ever had to swim upstream? Or wait, better yet, have you ever got on an escalator and tried to go opposite? My 6-year-old daughter did that the other day. She tried to go up the escalator that was going down, and she quickly realized how difficult that was. And I just remember during this moment as a leader during the pandemic, this is exactly how I was feeling. I was feeling that. And I was experiencing daily this loss of staff, and everybody was out sick for COVID. Their families were sick. They were leaving the organization because they just were deciding that they were scared of the pandemic, and they were at the end of their career in nursing. And then, not only that, every organization was feeling that. And so there was a big push for increasing the pay for these contracts. So I, on the ortho unit, started losing a mass loss of my experienced orthopedic nurses. And that's significant because we're a specialty unit. And I just remember that I was feeling the effects. The morale was down. The complaints of the providers, the patients, and the employees were all up. And that was evident by my patient experience scores being at 39%. Our senior team had focused on new grads, and we had raised the rate of pay for new grads, and we were getting new grads. However, we were not able to really train and develop those new grads because we only had new grads training new grads. And we were seeing that in our results because our RN turnover for our 1-year nurses were quickly rising. And it was because they were not feeling developed and they were not feeling supported. And I was starting to feel defeat as the manager because I knew I had to do something different, but I didn't know what that was.
So, Dannette, you said at the beginning of the podcast you've been practicing for more than 24 years. At this point, there had to be something that just felt different. What was different than when you first started in health?